So here's a pro tip for the day on this lovely, very quiet, at least for now, Saturday morning. If you or your kids are wearing those like compression sleeves, especially knee or leg, these compression sleeves that are so now hyper popular, especially amongst NBA players, college players, whatever, right? I would say you're probably doing more damage than good unless you 100% have a known venous return problem. In other words, if there's blood pooling in your feet or calves or legs, and you can actually see swelling around the feet, like often without them, then there might be some logic and reason to use them. However, if you're actually using compression and they're actually compressive on some level where, how should we say, they're certainly tight, right? They're kind of like you want them to be tight, but not really if you don't have this venous return problem. Because what you're doing is actually you're going to be cutting off some of that like blood flow, like more arterial supply, and actually creating less feed of blood circulation to the appropriate muscle and tissue. You're actually compressing those superficial blood vessels. So in actuality, in my experience, and I've seen a few times in practice, where you find out that, student athletes are wearing these compressive sleeves, yet their knees are hurting, their legs are hurting, their feet are hurting, and all of a sudden their stride changes, things slow down, and injuries become a little bit more commonplace. So yeah, stop wearing compression stockings unless you know you have a venous return problem, which is very few of us, especially young athletes. All right. The reason I even brought up the topic of the compression sleeves was because years ago, when I would wear them playing basketball, I would have much more knee pain, and I ended up having bigger problems, and my feet were going numb just by wearing these compression sleeves around my knees, thinking I was Rajon Rondo. So I started looking it up, and there was actually some literature, whether it was just suggested articles by some PhDs or sports scientists, if you will, or just, the science of it all, but why we would wear compression stockings. So I started looking it up. So that makes sense to me. So this morning I'm wearing my leggings. I'm wearing my long kind of nylon or spandex leggings. But the reason I'm doing it is, so if you've seen anything in the last few days, it was that I had eaten some pretty bad food. When I eat something bad, we're talking about like a very fast insulin and other hormone and blood circulation type response, where I'm pretty much becoming pre-diabetic very fast. Now remember, I've worn a continued glucose monitor to prove this stuff, and the reason I did this was in the last 48 hours, having a little bit more joint pain. Of course, this is all stemming and residual post second jab. But the point I'm making is my feet have been looking a little number or bluer, been a little bit more puffy around the edges. That's because, yes, one bad meal, one not well thought of meal that could send your blood glucose and fasting insulin levels to places that you don't want them. Trust me, nobody here wants to end up being a diabetic. Nobody wants to reach that point where they're dependent on metformin and insulin for their pancreas to work right. So again, this is actually me taking a measure to see if I can actually increase some of that venous return, to see if it'll make a difference. Because the last two runs, my knees were achy. My feet have been swollen. I have been feeling some tingling and numbness that I haven't felt in a while. All centered around either bad food choices or that inactivity that kind of screwed up my whole routine. which is why a routine is also so important. So I know it's a little long-winded, but it's about learning your body, knowing what makes it do well and what's counterproductive also. So I'm giving it a little bit of a life hack here today with the compression stocking. Well, not stockings today, actually, just the full, spandex kind of thing. And we'll see how it is at the end of this run, which I'm actually going a different route just to kind of stimulate some different visuals in hopes that it gets me to my half an hour mark. A little bit, although this one will be like a little under 3 miles, this loop, but it's got one big uphill, then the rest is pretty easy. Yeah, look at that. Look at that sunrise. That is fucking beautiful. Well, that just motivated me. I put some map in my step. My tiny little stride just went into a medium-sized stride. Enjoy your Saturday. We'll see you soon.